Carpal tunnel syndrome, pinched median nerve at the wrist. Carpal tunnel syndrome is by far the most common and widely known of pinched nerve condition. This video addresses what it is, who is at risk of this condition, how the condition is diagnosed, and what kinds of treatments work best. Carpal tunnel syndrome refers to symptoms caused by entrapment of the median nerve in the carpal tunnel. Carpal itself means wrist, so a carpal tunnel is nothing more than a wrist tunnel. This particular tunnel can be a crowded place as it contains not just the median nerve, but 9 tendons as well. The syndrome consists of some combination of pain, numbness, and weakness. Pain, numbness, or both are the usual earliest symptoms of carpal tunnel syndrome. Pain can affect the fingers, hand, wrist, and forearm, but not usually the upper arm or shoulder. Numbness affects the palm side of the thumb and fingers, but usually spares the little finger because it's connected to a different nerve. When weakness is present, it usually indicates that the condition is already severe, and when muscles atrophy, wither, it means the condition is even worse. The affected muscles are those downstream from where the nerve is pinched and can include those controlling any of the 3 motions of the thumb. In addition, bending of the fist knuckles of the index and middle finger can be affected, as can straightening of the second knuckles at the same fingers. When muscle atrophy is present, it is most evident in the muscular ball at the base of the thumb. Carpal tunnel syndrome occurs more frequently in women than in men. People who work with their hands a lot, for example, to sew, operate hand tools, or perform assembly line work, at increased risk for developing this condition. Various medical conditions can also increase the risk of carpal tunnel syndrome, including injuries, arthritis, diabetes, low levels of thyroid hormone, and pregnancy. In the case of pregnancy, carpal tunnel syndrome often appears in the 3rd trimester and resolves after the woman delivers. Optimum diagnosis of this condition combines the time-honored methods of a doctor's history taking and physical examination with tests of nerve function called nerve conduction studies. Nerve conduction studies are exquisitely sensitive in detecting impairment of the median nerve at the wrist, particularly when the median nerve is compared with a nearby healthy nerve in the same patient. In nerve conduction studies, the nerve on one side of the carpal tunnel is activated by a small shock to the skin. An oscilloscope measures how long it takes for the resulting nerve impulse to arrive on the other side of the carpal tunnel. When the median nerve is pinched, the nerve impulse is delayed or blocked. Nerve conduction studies are so sensitive that sometimes they show problems that aren't even causing symptoms. That's why nerve conduction studies don't stand alone in diagnosing carpal tunnel syndrome. The examining physician needs to decide if the results make sense for the particular patient in question. Nerve conduction studies not only show whether or not the median nerve is impaired at the wrist, but also provide precise data concerning how bad the impairment is. In addition, these studies survey the function of other nerves in the arm and hand. Occasionally, a nerve in an adjacent tunnel can also be pinched. In other cases, nerve conduction studies show that the problem is not one of the single nerve pinches, but rather a more diffuse pattern of nerve impairment called polyneuropathy. Of course, sometimes the studies are completely normal and suggest that the symptoms are due to something else. To treat carpal tunnel syndrome, starting with conservative treatment makes sense in most cases, especially when the symptoms are still in the mild to moderate range. Conservative treatment usually includes a wrist splint that holds the wrist in a neutral position. In a study published in 2005, researchers at the University of Michigan investigated the effectiveness of wrist-splinting for carpal tunnel syndrome in workers at a Midwestern auto plant. In a randomized controlled trial, the gold standard method for judging treatment, about half the workers received customized wrist splints that they wore at night for 6 weeks. The rest of the workers received education about safe workplace procedures but no splints. After treatment, the workers with splints had less pain than those without, and the difference in outcome was still evident after 1 year. Conservative treatment might additionally include use of anti-inflammatory medications like aspirin or naproxen, or even steroid drugs. A more intrusive, though still non-surgical treatment consists of injecting steroid medication into the carpal tunnel itself. This might benefit selected patients, but in a 2005 randomized controlled study of patients with mild to moderate symptoms, researchers at Vrije University in Turkey showed that patients receiving splints did better than those who received steroid injections. Surgeons can relieve pressure on a pinched median nerve by cutting a constricting, overlying band of tissue. A 2002 study at Vrije University in Amsterdam compared surgical treatment to 6 weeks of wrist-splinting. After 18 months, 90% of the operated patients had a successful outcome compared to 75% in the splinted group. In some cases, it can be reasonable to try conservative treatments without first confirming the diagnosis with nerve conduction studies. However, this risk-free form of testing should be performed prior to any carpal tunnel surgery. For detailed information on how to treat carpal tunnel syndrome effectively, check out Carpal Tunnel Master and Beyond on the link below this video.